Hi guys, this is our presentation over reducing suicide rates in adolescents by Macy, Lisa, Alexis, Kilee, and myself. In this presentation, we will talk about our LHI that we decided to pick, how we can work to fix the LHI, some different policies that have affected it, and also different people we believe that can help achieve reducing the rates of the LHI. Being in the healthcare profession, we all feel that mental health is very important. And with suicide being one of the leading causes of death, we all kind of need to take into consideration and educate ourselves on what suicide is and how mental health can affect different people.
So what is our leading health indicator? Our LHI is that in 2007, 11.3 suicides occurred per 100,000 people in a population. The goal for this LHI is to reduce it to 10.2 suicides per 100,000 people in a population, which would be a 10% improvement rate. And the geographic location that we chose is Ohio. So here we're comparing some local statistics in Ohio and versus some national statistics. According to the Ohio Department of Health, 5 people die every day from suicide and 1 youth dies every 33 hours. And in 2017, Stark County had estimated 1,750 suicide attempts. So this is Stark County, which is local. These are the people that you personally know. It could be your mom, your dad, your sister, your brother. You don't know, but it's these people that are affected. And for our national statistics, according to the CDC in 2017, the 10th leading cause of death was suicide, claiming 47,000 lives, which is a staggering amount. And between the ages of 10 to 34, suicide was the second leading cause of death. The second leading cause of death is kind of crazy because it's in comparison to other diseases and conditions like cancer and diabetes and heart disease. This could mean that suicide is killing more people than some of these other serious conditions.
This is our infographic for the project. We chose the pictures and statistics that are in here because we feel these show the severity of the issue and they show how bad suicide rates have gotten and how bad they continue to go and increase. There is suicide hotlines out there, lifelines, numbers you can call 24/7 for people who have mental illness or think suicidal thoughts. If they are tired of talking to their family or don't want to talk to their family or friends or counselors, they can call these numbers and have someone to talk to, express their feelings, let them know how they're feeling. Our graph shows the increase in suicide and how it just continues to go up every year. We can see that from 2007 to 2018, it has continued to rise. For our musical picture, we put that on there to represent how music therapy helps people with suicidal thoughts, helps reduce that. Suicide is the 11th leading cause of death overall in Ohio, which is crazy that suicide is taking that many lives. On average, one person dies by suicide every 6 hours. So thinking about that, you have 4 deaths from suicide every day, which is just crazy. In Ohio, there have been 1,491 deaths caused by suicide. And nationally, there have been 42,773 deaths caused by suicide. The rate of suicide per 100,000 population in Ohio is 12.57, and nationally it's 12.93. It's crazy to think how close those are, considering one is just one state and the other is nationally. Suicide cost Ohio a total of $1,736,643 of combined lifetime medical and work loss costs in 2010. Or if you think about it individually, it is $1,206,840 per suicide death. Suicide is the leading cause for many age groups. It's the first leading cause for ages 10 to 34, and it just continues to be the leading cause as the ages go up. So it takes lives all the way from the age of 10 to 65 and older, which is crazy that many people are taking their lives from suicide. Over twice as many people die by suicide in Ohio than by homicide, and the total deaths to suicide reflect a total of 29,543 years of potential life loss before the age of 65. The policy that we looked over and decided to talk about was the Senate Bill 126 of the 133 General Assembly. This policy is working towards getting the necessary help out there for people who struggle with mental health and suicidal thoughts. Some of the things that this policy talks about and wants to get out there is mental health professionals on school campuses, all the way from K through 12. That would include social workers, child psychologists, counselors, whoever they can get mental health wise that can help these students at school where they are the majority of their time. It gives mental health professionals authority to provide a crisis assessment to minors without parental consent. So minors can go and get this assessment and they don't have to talk to their parents about it first if they feel this is necessary. Suicidal crisis allows for interventions to be performed immediately. So if someone is thinking about suicidal thoughts or they want to commit suicide, that can allow for interventions to happen on the spot. And this bill is sponsored by Nathan Manning and was introduced April 19th of 2019.
It's important with any piece of legislation to look at the good and the bad of the legislation. While youth suicide is a very important issue in the state of Ohio and our nation, we need to make sure we're tackling the problem in the right kind of way. The pros of this policy is it would allow at-risk students to be identified in a consistent environment. Schools have a very set routine that would make it an easily observable environment for these trained mental health professionals to observe them. Research shows that mental health issues display first in schools than any other environment. Plus, this policy could help with the maldistribution of mental health resources in the different communities in Ohio. Not every community has the same clinics, psychologists, therapy options that some of the larger cities might. If we make these professionals available in public schools, that means every child who attends a public school will have access to these much needed resources. The cons, however, though, is the Department of Education is handling the funds for this legislation. So that means that to pay these workers, it would have to come out of the school's budget. This could reduce spending in other areas of the budget, which could take away from other important factors in a school day. So the budget needs to stay balanced for well-rounded school programs and to make sure that by boosting up one area, we're not taking away from the other area. We wrote an advocacy letter to someone we thought was important to this cause. We chose Senator Sherrod Brown. He's the only Democratic statewide official elected in Ohio. He's a senior Ohio senator. We noticed in his campaign, he is a huge advocate for mental health resources. A lot of milestones in his career have been expanding access to mental health. This is evident in 2019 when he dedicated $2.2 million for mental health expansion for the elderly in Ohio, so 65 and over, and then with his Medicare Mental Health Access Act, meaning he was trying to make Medicare be able to pay for different mental health services patients might need. So it's already on his agenda. It's already important to him. We're just trying to get him to expand that to the very vulnerable population that are the youth of Ohio. And you can see all of this on his Senate page. He's very open about his support for this issue.
So to conclude our presentation, mental health is a serious concern within our country and specifically in Ohio. How we talked about 5 people die every day by suicide within the state of Ohio, which is a large number, all things considering. And we feel that it is very important that changes are being made to raise awareness about issues with mental health, and policies like the ones we talked about are being implemented to make a difference regarding the struggles of mental health that many people have. And there's such a large stigma around mental health, especially for the younger population and the adolescents who it is most affecting. They are in public school, they're dealing with peer pressure from friends and their family, and they have their own personal life problems. So making sure that those resources that they might not have at home are available to them where they spend the most time at school is important to help reduce that stigma and spread the word about mental health and help reduce the rates of suicide in our youth. And Senate Bill 126 can be one of these life-changing and significant policies. So it is important that the community and influential people, such as Senator Sherrod Brown, work to get this bill passed. And some references that we use are the American School Counselor Association, the CDC, the Ohio Department of Health, and the Ohio Legislature, where we found information on Senate Bill 126.
Thank you.